as we talked about, there are a lot of challenges. There's a lot of inspirational things happening, but there's a lot of challenges. And one of the things that's happening now in the autism and developmental disability community is the vaccine distribution. And it's not really up to par quite yet, or where we think it should be. And there's nobody better to have on than my friend, friend of the foundation, and this wonderful leader in the autism and advocacy community, Maura Sullivan, I believe, I didn't look up your title, but I think it's Director of Government Affairs.
You got it.
Cool, at the Arc of Massachusetts. Maura, how are you?
I'm good, thank you. Thank you, Nick and Liz, for having me. I love being here. You guys are wonderful.
I don't know, you've probably been on 3. We got to start keeping tabs on who's been on our shows the most. This is probably number 3 or 4.
I want to win for the most time.
Yes. Ted, can you just tell us, obviously you're focused day in and day out on taking care of the autism population and the disability population as it relates to legislation and advocacy and that sort of thing. So what's happening? What's the current state of affairs with the vaccine rollout for our population who, studies have shown are disproportionately affected? Just the death rate, for lack of a better term, is, disproportionate. Like, what's going on out there right now?
Yes, so we have some good news. I think everyone should feel a little bit of hope because we have the vaccines in our congregate care, residential facilities and group homes across Massachusetts getting deployed, getting implemented, not only with clients and individuals, but also with staff. And this was a huge undertaking. A lot of the providers struggled. They weren't necessarily matched with the federal program. And really we're scrambling to get this done, but it's happening every day. We're hearing higher and higher numbers of people getting vaccinated, and the staff as well. So it was huge for our community. And then about just a week and a half ago, we heard that our home health care workers that come and work with so many folks with autism were prioritized to phase 1, which is great news. So that's people like personal care attendants, PCAs, that is AFC or adult foster care providers, that's DDS family support, our DESE grant skills trainers, anyone who works for DDS in the home. And of course, the home health care workers for those that have, medical complexities. So we were really excited to see that. We know that the actual implementation of that is tricky. These big sites are opening up across Massachusetts, Gillette and Fenway, and people are in the process of trying to figure out how to sign up and how that's going to work. So a lot to be excited about, but it's definitely has its glitches.
Yeah. And so in terms of those glitches, I guess, like, what are they and what can people do about trying to speed up this process?
Well, some of them are just patience and logistics and working that out. I know personally, my daughter is my son's PCA. So she qualified under PCA, and we searched the websites for an open appointment for hours, and then just yesterday, Gillette opened up a bunch of appointments this coming week and into the weekend. So you have to keep looking at the sites. We have, the links available. I can stick it in the chat too. The bigger problem is just the vaccines getting to Massachusetts. So we're not getting enough vaccines in. And of course, we need to make sure that the people who got their first vaccine will get their second vaccine, because this is critical in terms of accounting. And we want to open up the rest of phase 1 while we also open up phase 2 for people over 75 and people with 2 comorbidities. So there is a lot of that we need to make sure that vaccine is coming into the state.
Great. And so people, what would you advise people? But and I think this problem or issue is consistent across all states. Obviously, your focus is here in this state, but I'm sure you talk to your peers all over and our peers in the autism ID community, and I think it's a pretty steady refrain across the country. Is that right?
Yeah, I think every state wants more vaccine coming in for sure. We are really just getting those sites up, though, those bigger sites to do the mass vaccinations. So, you know, it is a little bit of timing as well. I think what we're hearing from our community, and I get to have this, you know, I'm not in the front lines, but I get to have that front row seat and hear from so many families. And I think families are feeling relieved that their sons and daughters are kind of in the queue. If they're in a group home, if they're in a residential program, or now if they're in a day program. So that was a huge change and a really good move on the state to include folks who are in day programs as part of congregate care. So people that are running those day programs are now kind of adding those names into the list of people who can be given the vaccine. But who does that leave out? You know, that leaves out everyone who's living at home, who doesn't attend a day program, and it leaves out caregivers, you know, and I think we caregivers, we've been going strong for almost a year now. And they always tell you, you know, put your mask on first, but we have not been able to do that this year. And not only do we not get our masks, but I think we're in last place right now. So we need to do some advocacy to try to get caregivers into phase 2. And right now, our coalition, you know, the ARC works with wonderful partners in a health coalition, and we're writing a lot to the advisory committee, to the administration, and we're saying include these people, expand the comorbidity list, let's clarify it so that we can make sure, at least for now, that phase 2 includes more folks from our community.
Great. And so last thing, we want people to, you know, notify their representatives, their congresspeople, both here in Massachusetts and nationally. Obviously, nationally, you just, you know, look up, you know, who you got to call or whatever. But here in Mass, people can, I assume, on the ARC of Mass website, like you guys, you have some specific verbiage that people can cut and paste and use and that sort of thing, correct? And where can they go to get that?
Yeah, you can find lots of information about the vaccines and who to contact for your own legislator and your congressperson, all on our website on our advocacy tab. And
which is arcofmass.org, A-R-C of
thearcofmass.org, right?
Yeah, right. So Google ARC of Massachusetts or go to thearcofmass.org, right?
You can find your congressperson and your local legislator as well. So yeah, they can push the administration, and we're doing everything we can, and we'll keep people informed as well. Yeah, cool. No, thank you so much, Maura, for hopping on. I know this was kind of a last minute thing, but I thought it, you know, Liz and I both thought it was a really important issue to include in tonight's show because it's the issue that our population is dealing with right now, among many other issues. Absolutely, you know? And it changes fast. So have me back again.
Yeah, right. Yeah. And we're going to cut this little interview too and post this online in the next couple of days as well. So Maura Sullivan, ladies and gentlemen, Maura, thanks for coming on. All
right. Stay well, everybody.
Yes. All right. So that was good to have Maura on, bring us up to speed. Obviously, we like to have a lot of fun here, but we can't always be having fun without letting people know what the real issues are that we're all facing and dealing with out there. So that was good.